Which nerve innervates the parotid gland? The correct answer is B. Glossopharyngeal nerve. The glossopharyngeal nerve C-vent Roman 9 provides parasympathetic innervation to the parotid gland via the otic ganglion, which structure lies between the superior mesenteric artery and the aorta. The correct answer is C. Left renal vein. The left renal vein passes between the aorta and superior mesenteric artery, which lymph nodes drain the lateral breast and upper limb. The correct answer is D. Lateral humeral axillary nodes. The lateral humeral axillary nodes drain most of the upper limb and lateral breast, which artery runs with the radial nerve in the radial groove. The correct answer is C. Deep brachial artery. The deep brachial artery profunda brachii accompanies the radial nerve in the radial groove, which structure connects the uterus to the labia majora. The correct answer is A. Round ligament. The round ligament passes through the inguinal canal to connect the uterus to the labia majora. Which part of the brain controls voluntary movement? The correct answer is D. Primary motor cortex. The primary motor cortex precentral gyrus initiates voluntary motor movements, which structure passes through the obturator canal. The correct answer is B. Obturator nerve. The obturator nerve exits the pelvis through the obturator canal to supply the medial thigh, which structure prevents hyperextension of the knee. The correct answer is A. ACL. The anterior cruciate ligament ACL prevents anterior displacement and hyperextension of the tibia, which structure passes posterior to the medial malleolus. The correct answer is C. Tibial nerve. The tibial nerve passes posterior to the medial malleolus within the tarsal tunnel, which structure is at risk during thyroidectomy. The correct answer is D. Recurrent laryngeal nerve. The recurrent laryngeal nerve is closely related to the thyroid gland and at risk during surgery. Which muscle is innervated by the thoracodorsal nerve? The correct answer is B. Latissimus dorsi. The thoracodorsal nerve innervates the latissimus dorsi, which laryngeal cartilage forms a complete ring. The correct answer is B. Cricoid. The cricoid cartilage is the only complete ring of cartilage in the respiratory tract, which structure is located anterior to the kidney. The correct answer is D. Pancreas. The pancreas lies anterior to the left kidney, which ligament attaches the liver to the anterior abdominal wall. The correct answer is C. Falciform ligament. The falciform ligament connects the liver to the anterior abdominal wall and diaphragm, which muscle initiates shoulder abduction. The correct answer is C. Supraspinatus. Supraspinatus initiates the first 15 degrees of shoulder abduction. The pituitary gland is located in which part of the skull? The correct answer is B. Sphenoid bone. The pituitary gland sits in the sella turcica, a depression in the sphenoid bone. Which nerve is at risk in a posterior hip dislocation? The correct answer is B. Sciatic nerve. The sciatic nerve lies posteriorly and is at risk in posterior hip dislocations. Which muscle forms the medial wall of the axilla? The correct answer is C. Serratus anterior. The serratus anterior forms the medial wall of the axilla. What structure connects the lateral ventricles to the third ventricle? The correct answer is C. Foramen of Monro. The foramen of Monro interventricular foramen connects the lateral ventricles to the third ventricle. Which nerve innervates the skin over the anatomical snuff box? The correct answer is B. Radial nerve. The superficial branch of the radial nerve innervates the skin over the anatomical snuff box. Which artery supplies the lateral aspect of the cerebral hemisphere? The correct answer is B. Middle cerebral artery. The middle cerebral artery supplies most of the lateral surface of the cerebral hemispheres. Which nerve innervates the diaphragm? The correct answer is B. Phrenic nerve. The phrenic nerve C3-C5 innervates the diaphragm and is essential for breathing. Which organ lies retroperitonally? The correct answer is D. Pancreas. The pancreas lies retroperitonally except for the tail, which is intraperitoneal. Which bone articulates with the talus to form the ankle joint? The correct answer is D. Tibia. The tibia articulates with the talus to form the ankle joint talocrural joint. Which structure anchors the spinal cord to the coccyx? The correct answer is C. Filum terminale. The filum terminale is a fibrous extension anchoring the spinal cord to the coccyx. Which nerve exits the pelvis via the greater sciatic foramen? The correct answer is C. Sciatic nerve. The sciatic nerve exits the pelvis through the greater sciatic foramen below the piriformis. What is the function of the pubotalis muscle? The correct answer is C. Maintain anoctal angle. Pubotalis maintains the anoctal angle and contributes to fecal continence. Which structure defines the lateral border of the femoral ring? The correct answer is C. Femoral vein. The femoral vein lies lateral to the femoral ring. What is the function of the tensor tympani muscle? The correct answer is B. Tense tympanic membrane. Tensor tympani dampens loud sounds by tensing the tympanic membrane. Which structure passes through the carpal tunnel? The correct answer is D. Flexor digitorum superficialis tendon. The tendons of flexor digitorum superficialis pass through the carpal tunnel with the median nerve.
Ace your medical exams. Study smarter with Scrolls MD. Scrolls MD is your all-in-one app for medical students and doctors worldwide. Dive into thousands of high-yield MCQs with detailed explanations, smart flashcards using active recall and spaced repetition, plus condensed notes and full-length mock exams. Prep for USMLE, PLAB, MCCQE, AMC-CAT, NEET-PG, and more. Import Anki decks, track your progress, focus on weak areas, and study offline with dark mode. Thousands trust Scrolls MD to build mastery and crush their exams. Download now and study smarter with Scrolls MD.
Which cranial nerve exits the skull through the jugular foramen? The correct answer is C. Vagus nerve. The vagus nerve CNX exits the skull via the jugular foramen. The axillary nerve can be injured in which type of shoulder injury? The correct answer is B. Shoulder dislocation. Anterior shoulder dislocation may damage the axillary nerve. What is the primary blood supply to the femoral head in adults? The correct answer is C. Medial circumflex femoral artery. The medial circumflex femoral artery is the major blood supply to the femoral head. Which nerve is responsible for innervating the diaphragm? The correct answer is B. Phrenic nerve. The phrenic nerve C3-C5 provides motor innervation to the diaphragm. Which structure passes to the foramen magnum? The correct answer is C. Spinal cord. The spinal cord passes to the foramen magnum, connecting with the brainstem.